Really great question, and it's got both a policy and political answer. So the FDA, Food and Drug Administration, is legally required to remove food dyes, but not necessarily other additives to food. The idea here being that food dyes are not necessarily something we need to live and subsist on. They just make food look nice. The FDA is required to remove food dyes that pose a cancer risk to either people or animals. So it doesn't just have to be a human link. Demonstration in animals can be sufficient. Now, red dye number 3 in the past for decades has been shown to increase the likelihood that lab rats and other animals develop cancer. The link to humans is much more tenuous in some of that research. But because there's already an existing policy on the books that tells the FDA how to act, if the FDA were to simply decide that the quality of the evidence or the balance of the evidence were to become more compelling in showing that a food dye causes cancer in animals, that's enough for the FDA to be able to take action. So the answer to this question is really twofold. How was the FDA able to move so fast? That's a matter of policy. It's because existing policies were on the books that enable the FDA to simply reinterpret the available evidence. Why did the FDA move fast? Robert F. Kennedy Jr. has threatened to fire hundreds of employees throughout HHS who are not loyal to implementing his and the president's vision. And so this could be a way for career civil servants of the FDA to show that they're willing to play nice with the Trump administration. Relatively easy victory for RFK Jr. before he even assumes the role, if he ends up assuming the role.